Let's talk about the anatomy of the TMJ. First of all, TMJ stands for temporomandibular joint. And it's this joint right here that connects the lower jaw or the mandible to the temple bone. And it's basically a ball and socket type of joint. As you can see, it's a ball on the back side of both sides of your lower jaw, and the socket is right up in front of your ear. In fact, you can feel this move if you put your finger in front of your ear and open and close. You can feel the jaw joint move. This joint is unique in the body in two respects. Number one, it's a two-part joint. There's a right side and a left side that are joined by a solid piece of bone, and you can't separate one from the other. Most people that have TMJ problems have it only on one side, but we have to treat the whole jaw because they're inseparable. The anatomy, besides the lower ball and the upper socket, also contains a cartilage disc which looks like this. It's very slippery and malleable, and it should fit in between the ball and the socket, just like that, and stay between the two bones at all times. So if you're just talking, it sits there and acts as a cushiony surface for the jaw to rotate on. If you open wide and slide your jaw forward, the disc should slide forward with the ball at all times. Probably 75% of all TMJ problems are caused when this disc becomes ruptured out of place, and it generally gets displaced to the front. The first symptom is clicking and popping in the jaw, because when you move your jaw forward, it clicks and pops over that little disc. The second part of the whole mechanism are the muscles that open the jaw, and they sit just about like my hand, with a big flat muscle up in the temple area, a long strand of which runs down behind your eyeball and connects onto the lower jaw right here. If there's something going wrong in the jaw joint, inflammation or disc out of place, then these muscles will tend to contract, and the result is muscle contraction headache, sore teeth, sore jaws. So it's a combination of something going wrong in the joint, the TMJ per se, and the muscles that open and close the jaws. TMJ is called the great imposter because it can cause blurriness in the vision, ringing in the ears, a toothache, in addition to the typical clicking and popping of the joints. We know for sure the longer you leave your TMJ untreated, the harder it's going to be for me or anyone else to treat it. 90% of the time when we treat TMJ problems, we do it with a simple, removable splint that fits over the upper teeth, just like this. It does not come across the front, so it can be easily worn during the daytime without anyone knowing you have it in. The purpose of this is to unload the jaw joint and to get those muscles in a relaxed position. This is made by taking a model of your teeth, and we make them right here in our lab so we can get them done within 24 hours for you. Thank you very much.